Welcome to Common Mental Health Issues in the School-Age Population, Part 1. Please adjust your speakers and advance to the next slide. Please understand that this information is not intended to teach you how to diagnose mental illness, but to increase your awareness and understanding of common mental health issues faced by your students. Generally speaking, medications can be used to help manage symptoms, but rarely do they cure the mental illness. Sometimes medications are used to help manage symptoms until the student can manage them without help. All medications have side effects. Some are more pronounced than others. And you also need to know that sometimes students will cheek their medications, meaning keep them in their cheek or under the tongue, and later retrieve them to give or to sell to peers. Finally, please know that some medications have very narrow therapeutic windows and require regular monitoring of blood levels by a physician or healthcare provider. And some medications may have an immediate impact, while others require several weeks to build up over time. One of the most common mental health conditions among school-age children is depression. Symptoms of depression may include poor appetite or overeating, insomnia or hypersomnia, meaning sleeping too much, low energy, fatigue, and low self-esteem, poor concentration skills, difficulty making decisions, and overall feelings of hopelessness. For depression to be clinical in nature, it needs to have lasted at least a year, and very often in adolescence, clinical depression sometimes presents as aggressive behavior. Depression cannot be caused primarily by substance abuse, although sometimes children will self-medicate to try and manage their depression. Symptoms of clinical depression include distress and impairment in social, occupational, or other important areas of functioning. In contrast to clinical depression, a single depressive episode may last from 2 weeks to 2 months. Keep in mind, any talk of suicide is a red flag for educators, and you must get help. Related to depression in adolescence are eating disorders. Eating disorders include anorexia, which is the refusal to eat, bulimia, which is the binge-purge cycle, and in order for this to be clinically significant, it must occur at least twice per week for at least 3 months. Also, there is something called pica, P-I-C-A. This consists of eating things that are not food, like pencils. Pica is typically a symptom of other illnesses. One of your students has told you a secret. The secret is that he feels like hurting himself. When you ask him what he means, he says, "I feel like cutting myself with a knife tonight at home." What should you do and when? The answer is you must act immediately. This child has the intent, he feels like cutting himself, he has a plan, tonight at home, and he selected a weapon, a knife. You need to notify your administrator and possibly contact authorities immediately. Most importantly, do not let the child out of your sight. 2 more common conditions are ADD, Attention Deficit Disorder, and ADHD, Attention Deficit Hyperactivity Disorder. Both of these are medical diagnoses given by a physician or healthcare provider. Among the common symptoms of these are difficulty initiating and sustaining attention and a lack of follow-through, but probably the hallmark of this in school is a wide variability in work quality. This will be an A student one day and an F- student the next. Impulsivity and hyperactivity may also be present. In order for this to be clinically diagnosed, it has to be present before the age of 7 and persisted for at least 6 months. What are the positives and negatives associated with children using prescribed medication for ADHD? First of all, among the positives, very often, probably 80% of children who are prescribed medication, it works and it helps them control the symptoms. As far as negatives go, all medications have side effects of varying degrees, and that has to be taken into consideration. Ideally, students would be on the medication until they're able to function fully without the assistance of the medication. Many school-age children deal with substance-related disorders. It may be related to dependence, abuse, intoxication, or withdrawal from specific substances. In order for it to be clinically significant, it must have been present for at least 1 month and can include both physiological and psychological dependence factors. Polysubstance abuse, that is, the use of more than one illegal drug, is very common in adolescents who are also dealing with mental health issues. Another fairly common condition among the school-age population is Tourette's disorder. This used to be known as Tourette syndrome, but it is now considered a disorder. Tourette's disorder consists of multiple motor and/or vocal tics that occur several times per day, and it almost always appears before the age of 18. These tics can cause marked impairment and social distress in the student. However, they can be briefly controlled in some cases by the student. Bipolar disorder is also known as manic depressive illness. This illness features depression and manic episodes and is characterized by wide mood swings. Obsessive compulsive disorder is an anxiety disorder that is characterized by recurrent thoughts, the obsessions, and recurrent behaviors, the compulsions. The person is usually aware of the symptoms and may actively try to suppress them, often without success. What you will see in obsessive compulsive disorder are repetitive hand washing, repetitive counting, praying, repeating words, and so forth. Schizophrenia is one of the most common mental illnesses in the United States. It is characterized by delusional thinking, hallucinations, disorganized speech, and disorganized behavior. It may or may not include responding to internal stimuli. For it to be clinically significant, it must have existed for at least 6 months and may also include catatonia and paranoia. One of the most common mental health conditions is a federal disability category known as emotional disturbance. In order for a child to be classified as emotionally disturbed, one or more of the following 5 behaviors have to have existed for a long period of time, meaning months and years, and to a marked degree, meaning that it's so prevalent that the behaviors interfere with normal life functions. The first symptom is an inability to learn, which cannot be explained by intellectual, sensory, or health factors. That means the learning problem isn't because of low intelligence or vision or hearing issues or illnesses or missing school. Number 2 is an inability to build or maintain satisfactory interpersonal relationships. In school, you'll see this as best friends changing frequently, and the friendships these students have are limited both in number and in length. The third symptom of emotional disturbance consists of inappropriate types of behavior or feelings under normal circumstances. For example, students who feel sad when most people would react with happiness, students who laugh when most people feel sad, and in general feelings of fear when others feel safe and secure. Number 4 is a general pervasive mood of unhappiness or depression. All of the clinical depressions and dysthymias and other diagnoses of depression are included in this. And finally, the 5th symptom is a tendency to develop physical symptoms or fears associated with personal or school problems. You'll see this as unreasonable fears and phobias, frequent complaints of headaches or stomach aches, becoming physically ill when preparing for a personal or a school-related activity. So how can you help a student who has unreasonable fears about school become successful in your classroom? Well, you break it down into tiny chunks, even if it's only a few minutes at a time, and you make sure that those chunks are things that student can be successful in. Eventually, you'll be able to expand the length of time and the level of success. Please advance. Another common mental health issue in classrooms is something called conduct disorder. Conduct disorder is a pattern of violating the rights of others and/or violating social norms for a period of at least 6 months. It may include aggression toward people and animals, the destruction of property, deceitfulness and theft, serious rule violation, and it may also involve fire setting with the intention of causing serious property damage. These behaviors, as you can imagine, cause impairment in social, academic, and occupational functioning, but it's really important to remember that in conduct disorder, the behavior is volitional. That means the child is doing it on purpose. It looks a lot like emotional disturbance, but a child with emotional disturbance is not able to control the behaviors a child with conduct disorder is. So even though the behaviors and the symptoms look alike, you must treat them very, very differently in order to be successful in a classroom. You have a 15-year-old in your class who has recently gone through a dramatic change in behavior. Until recently, he was an average student with a small but loyal group of friends. Now he's hanging out with a different crowd, he's failing all of his classes, and he is openly defiant towards adult authority figures. His mother is convinced he's emotionally disturbed, quote, just like his father, she says. Do you agree or disagree, and why or why not? Remember that emotional disturbance has a very early onset and conduct disorder does not. This is a student who may be exhibiting the behaviors associated with conduct disorder. There may also be some substance abuse involved with this as well. If you're in a classroom, it's important that you observe and document what you see. If you'd like more information and more strategies for any of these conditions, my email address is on the next slide. If you would like more information about this or other topics, please contact me.